morning. My name is Jessica. I'm a student nurse from CF. I have some orders to go ahead and perform some trach suctioning today. And we're also going to do some trach care later on, okay? I'm going to go ahead and begin. If you could tell me your name and date of birth, please. Gary Gray. Okay, and your date of birth? November 12, 93. Perfect. Just going to raise the bed to a working, comfortable position. Okay, so Mr. Gray, what we're going to do, I'm going to go ahead and insert a suction catheter that's going to go into your tracheostomy. It's going to suck out all of the secretions and mucus that you have been building up. So that'll help you breathe a little bit better. All right. If at any time during this procedure you feel like you need to stop or you need a breather, why don't you go ahead and lift your left hand, and that way I'll know to go ahead and stop. All right. First thing I want to do is do a lung assessment. I'm just going to listen to your lungs. And I would also auscultate his posterior lung sounds, but for the purposes of this video, I'm going to go ahead and let him remain seated the way he is. Alright, so I did auscultate some audible gurgling and some crackling in there, so hopefully the suctioning is going to help with that. I am monitoring him on the screen, his O2 saturation and his respirations. Right now he is at about a 92 O2 sat and about a 12 respirations per minute. So we're going to continuously monitor that. All right, Mr. Gray, I'm going to go ahead and get gowned up and prepare my equipment. I would also don my mask for this procedure. But again, for the video, we'll go ahead and leave that out. So I'll set this aside. I am going to check my suction. Make sure we got it working. I'm going to set it at about 110. That's working good. Mr. Gary, I'm just going to lay this over your gown so we don't get any unwanted stuff.
I was just trying to tell you to throw that away. Oh, so you wouldn't touch your hair. Okay. And you touched it with that.
I do have my normal saline here. It has been previously opened within the last 24 hours, so I will ensure that I lip it, and I have checked for my expiration date, and I'm looking for any cloudiness, and it is clear, so we are good to go with that. 30 mLs. I'll get that in a bit. Can I go ahead and hook this? Alright, Mr. Gary, when I insert this into your trach, you may feel a little bit uncomfortable. And you may even feel the need to cough, which is normal. So you can feel free to go ahead and do that. I'm going to go ahead and start. Make sure my suction works. Insert until resistance is met. Pull back about a centimeter. Okay.
The nurse before me was not a good nurse.
Put the oxygen back on. Clear out my secretions. Alright. Now we would normally wait 30 seconds to a minute in between suction. But for the purposes of this video, we're going to go ahead and continue on. While I am waiting for those 30 seconds to pass by, I'm continuously monitoring the O2 sat on the monitor and watching his respirations. Gary, one more time.
Gary Grant, 2/15/1947. Thank you, Mr. Grant. Sometimes this procedure, it can be a little bit suction, uncomfortable, or cause discomfort. At any point in time that happens, I would like you to lift your left hand.
Ensuring we don't suction for any longer than 15 seconds per suction. set here. If I needed to do it one more time, if I felt it was necessary, I would go ahead and do so, but for purposes of this video, 2 times is sufficient. I'm gonna disconnect my suction. Gary, I'm just going to go ahead and auscultate your lungs again and compare them to how they were previously. Now dispose. Alright. And again, I would also auscultate his posterior side by having him turn over on his side. I did notice some minor crackles, but definitely no more gurgling, and it was definitely an improvement from what we had before. His O2 sat is now at a 97%, and his respirations are at a 18. So we are good to go for that. How are you feeling overall, Mr. Gary? You feel like you can breathe better? Alright. Good. So what I'm going to do now is I'm going to provide some trach care. I'm going to remove your dressing and clean you up a bit, okay? It's not a physician's order, but I want to make sure that we keep that area clean. I'm going to have my assistant provide me with some clean gloves to remove the dressing. Please excuse me. And I would have not left my patient at the bedside with the side rails down up, and him being predisposed to injury. I would have an assistant bring me the gloves. Do you want to state that? So with my clean gloves, I'm going to go ahead and remove your dressing. Noting for any drainage, coca, color, odor, consistency, amount. A new chuck pad. I have my peroxide and my sanding, and again, checked expiration dates. They both have been opened previously within the last 24 hours, so I will make sure I lick them.
And repeat the procedure. Existence of vaccine by suction is 50 seconds. Okay, Mr. Grant, you have to finish the suction portion.
Also, I would have done hand hygiene prior to touching my patient once again.
Around the tree. Sometimes it gets
Should I lift it? No cloudiness, it's clear, intact. Pour it into my 3 separate basins. Oh. Flip it. It's my peroxide onto my half and half. How you doing, Mr. Gary? Good.
Are you doing okay, Mr. Grant? Almost done.
It's backwards.
Right under class and out of bench.
Just gonna remove the inner cannula with my non-dominant hand.
In this case, I would get a pair of sterile gloves. But the video purposes, I will just leave out a half gotten here.
Drop it into my half and half. Use my spoolie. And scrub.
I'm removing my pair of sterile gloves. I am looking at non-sterile. Look like
I will use this to clean the inside. into my normal saline to rinse. Use my forceps to agitate. And dry. Dispose.
There's also one at this point.
I'm also going to use the dry one to go ahead and dry the inside. Pipe cleaner. Dispose. I'm gonna go ahead and clean. Dip my swab into the clean normal saline that I have left. And clean around the faceplate
And this first.
and underneath.
This is the place plate or behind the ear. This prevents artery. For adult, I will do one
Go ahead and do it one more time.
side of the neck. And then for infant, so how to do that, I will take one side time already. And then to the other side, then take hold one off. So therefore it's secure at all times.
Go ahead and dry.
Here's that with our procedure. Are you feeling okay? Make sure you have your oxygen on. I can tell your respiration's going down. We'll do a quick assessment first to make sure
And
that
let's
is.
see. And place the new dressing underneath.
Protocol, which is one bed, most position. Mr. Grant has his call light within reach.
And change my collar.
Wash my hands, wash my hair, and then go down.
You did it.
Go ahead and lift your head, Mr. Gray.
I don't have tunnel
But you
syndrome.
stated, see, that's the thing.
It's a little tricky here.
You proceeded and did not say.
Slide it in. All right. Once I've ensured this side is tied, I will go ahead and remove the old collar.
I thought you think, but.
Not too tight, making sure there's room for 2 finger breaths. Go ahead and remove the old collar gently. Alright. And the same thing with this, we're going to be noting for any drainage, residue, inspecting for coca, as usual. Dispose. Alright, Mr. Craig, we are all set. Put your oxygen back on. Get rid of this. Just clean my area. And that completes trach care. position, my client in the lowest position, call bell within reach, side rails up, and document. Is there anything I can get you while I'm still here, Mr. Gray? No? Alright. Perfect.